you can go suddenly red or feeling that you're red when you are in situations that you know you are going to feel embarrassed, such as in family or friends, socially amongst friends that you know very well, or people you don't know very well. So it can occur, for instance, before you give a presentation or a meeting. So just the fear of going red is often the triggering factor for going red. So it's a nervous reflex that occurs in awkward situations, and that sudden redness tends to last for about 10 to 15 minutes, sometimes longer, but that's typically the length of time. And it's often a feeling of warmness and redness that starts from the chest or neck and goes to the face. And once you're out of that awkward situation, the blush reflex stops. So that is often the commonest cause of what we call facial blushing. Now, you can go red in other situations, but they are rarely caused by, you can predict those situations. So if you're red or hot due to exercise, for instance, or catching the sun or drinking alcohol, that isn't the same as an acute facial blushing. So acute facial blushing tends to occur mainly as a nervous reflex caused by feeling awkward or being caught in embarrassing situations. There are some other rare causes of facial blushing or flushing, such as abnormal hormones, which you can get with thyroid disease or menopause, but they are not, they don't tend to be the commonest cause. So the answer to the question ultimately is that the facial blushing, and certainly the facial blushing that is amenable to treatment with a sympathectomy, tends to be acute onset, caused by being caught in embarrassing and awkward situations. And if you get red face in situations that doesn't relate to these awkward or embarrassing situations, then it is not the typical, it's not a typical cause of facial blushing, and those cases will often need to be investigated as to why that occurs. So facial sweating can be they are linked to facial blushing because it's the same nervous system that causes facial sweating that causes facial blushing. It is called the sympathetic nervous system. And often some patients may blush and sweat at the same time. So if they feel anxious due to embarrassment, they can blush and sweat. And one of the two tends to be the dominant one, blushing and then sweating. Also, you can get facial sweating on its own without any evidence whatsoever of facial blushing. And that sweating often occurs with anxiety or being caught in situations that also cause facial blushing. So for instance, if you have to give a presentation, you may break out into a sweat. If you're caught in awkward situations or embarrassing situations, you can break out into a sweat. Some people sweat on their face all the time and have an overactive sympathetic nervous system, and there may be no triggering factors. So, but it's still the same nervous system that makes you sweat on your face, that makes you blush, but the cause of it, which tends to come from a part of the brain called the hypothalamus, may be triggered by different factors, anxiety, temperature of the outside, or just your overall general makeup. So to summarize, facial blushing and facial sweating do go hand in hand. There's a complete overlap with the cause of facial sweating and facial blushing, but the triggering factors may be slightly different with facial blushing and facial sweating, but there is certainly an overlap. So hand sweating is generally caused by an overactive nervous system, and it is generally, there isn't generally an underlying cause for overactive hand sweating. It can occur in teenagers, or it can occur in elderly patients, but often the overactive nervous system for the hand sweating tends to start in the younger age group and may continue into the 20s, 30s, and 40s, or even later. And many people who get hand sweating are very embarrassed, are afraid to shake people's hands, can lack confidence, have low self-esteem, can avoid jobs in which their hands, they have to use their hands, such as if you're an accountant and you have to write a lot, then you'll be embarrassed if the paper that you write on is full of sweat, or a computer keyboard is full of sweat, or if you have to shake hands in your job because of confidence, people may be embarrassed to shake hands. And other people sometimes can interpret that as a form of weakness or some social problem. And so the main cause of hand sweating tends to be, there isn't an underlying cause, it's just part of the body's makeup. And it can be unfortunate, and rarely is an overactive sweating of the hand caused by a medical pathology, some serious medical condition. Most of the time, overactive hand sweating is just a spontaneous one-off event in that individual for which there isn't an obvious cause. So that good, the management of facial blushing is unique to the individual. Okay, so for instance, some people who blush a lot can live with it. It's not something that is going to dominate their life. They may feel awkward and they're comfortable in their own skin. They may not like the blushing, but actually it hasn't really stopped their quality of life, or their quality of life, or where they see themselves going. Many people who blush are quite confident, except in certain situations, and they may learn to cope with it. For some, the blushing, they need professional help. It becomes such a big thing that it impacts their life. It can impact them socially, professionally. Some people will avoid leaving the house. Some people may avoid getting certain jobs because the jobs will involve more social interaction and the fear of blushing. So every patient who seeks treatment for or help for facial blushing will have their own unique story individually to them, but although there's a big overlap. And generally, the best thing for most is to try to self-help. Can you overcome anxiety? Can you overcome your phobia to the face going red? And that is often just starts off with just basic mindfulness, well-being. You can try, some people have tried psychotherapy, hypnotherapy, cognitive behavioral therapy. These are sort of mind over matter type of issues, treatments in which you can try and overcome your phobia to going red, just like you may overcome your phobia to flying or spiders and so on. So that's a good starting point. And these, again, are for people that feel that they need some help. Many patients may go to their general practitioner or family doctor and who may not be aware of facial blushing as a condition, and some may be unfamiliar with the treatment options. But if you were to try medication, then often anti-anxiety medication are the medication of choice, such as beta blockers. Propranolol is a classic one. Or you could, some GPs may try some antidepressants. Not that you are depressed, but they can have some beneficial effect on you feeling better in yourself and feeling more confident. So the treatment for facial blushing will it can be just an awareness, but you don't need any particular treatment. You can try some form of mind therapy, and there are various different types you could look at, some self-help, some professional mind therapy. You could try some medication, and then there's an operation called a sympathectomy that can be done, that I would always suggest you try as a last resort, never as a first resort, because most people should try with the simple things, and only a few will come on to surgery if they felt it necessary. And that's called a sympathectomy. For facial sweating, the treatment of facial sweating, again, is something similar. Psychotherapy and hypnotherapy and cognitive behavioral therapy doesn't really have a big impact on facial sweating, in the sense that it's not going to stop the sweat. And there are some tablets you can take for facial sweating that some people may, again, see their GP, and those drugs tend to be what we call anticholinergic drugs. They do have some side effects, and but they can be tried as a first line. And again, for most patients, they may be able to live with their facial sweating, but in some individuals, it can be so profound that they feel something needs doing about it, because they feel completely embarrassed and awkward if their face were to sweat all the time. And in those situations, an operation called a sympathectomy, which is also done for some patients with profound facial blushing, then may be useful. So there is an overlap in some of the treatment for facial sweating and facial blushing. So anxiety has a big area to play in facial blushing and sweating and hand sweating. Anxiety tends to always cause a discharge of nerves called the sympathetic nerves, which are nerves that start their journey in a part of the brain called the hypothalamus. And that not only does it make you anxious, it makes your heart rate speed up. So anxiety has a big part to play in all of the functions of the sympathetic nervous system. And that's why, if you can be calm and controlled, then that can help some individuals. But having said that, there are many patients who are calm, but any slight trigger of emotion can cause a flooding of the sympathetic nervous system and cause your hands to sweat, your face to sweat, or to go suddenly red. And then that can be a simple thing like preparation for an exam, someone who comes to say hello to you, and so on. It can be just a minor thing in which you haven't got time to prepare yourself. You may have time to prepare yourself for a presentation, like a meeting or a talk, but if someone catches you unaware, that can be all it takes for this sympathetic cascade to occur from the brain, and for you to suddenly go red or have a hand sweating and so on. For some patients who sweat a lot on their hands and face, it can be related to the temperature of the environment. So if you're in a hot environment, you're more likely to sweat more than if you're in a cold environment, but that's not always the case. So many patients may sweat and they live in a cold country, so that it doesn't always correlate.